Hello, I'm Yvette Torres, and welcome to another edition of The Road to Recovery. Today we'll be talking about prevention and early intervention in behavioral health, promising practices. Joining us in our panel today are Kristen Brennan, Executive Director, Fairfax Partnership for Youth, Fairfax, Virginia. Dr. Richard Brown, Professor of Family Medicine, School of Medicine and Public Health, University of Wisconsin, Madison, Wisconsin. Gail Ritchie, Public Health Analyst, Center for Mental Health Services, Substance Abuse and Mental Health Services Administration, U.S. Department of Health and Human Services, Rockville, Maryland. Dr. Pierluigi Mancini, CEO, Clinic for Education, Treatment, Prevention, and Addiction, Incorporated, Norcross, Georgia. Pierluigi, between 2002 and 2011, the total number of adolescents that received prevention messages through the media went from 83.2% in 2002 and 75.1% on 2011. Are we reaching enough young people with prevention messages?
Well, I think the question is, how are we trying to reach the youth with prevention messages? I think that the development of technology today has given us an opportunity that we haven't quite caught up with. Traditionally, we have public service announcements, we have school activities, but today we have Facebook, we have texting, we have an ability to find new ways that we haven't quite exploded yet.
So the media we have to look at from a broader perspective, not just the broadcast media, but everything that the youth are using today.
That's correct. And I think that what we're doing is we also need to measure or find a way to measure how it is that we are reaching them through this new media.
Absolutely. And Kristen, the same figures hold true for the school-based youth. It went from, in 2002, from 78.8% of all youth that were in school receiving, in adolescents to be specific, that were receiving messages through their school-based environment to 74.5% in 2011. What do you think happened?
I know that for our programs in Northern Virginia, we do survey our youth annually, starting in 6th grade and going through 12th grade. And so that has enabled us to learn a lot about exactly what's going on. We ask them about all kinds of behaviors and practices. So it gives us more information than we used to have.
And what information are you getting? We're
learning which trends are improving, which ones are not. Things such as suicidality, the number of youth who have considered or attempted suicide, bullying behaviors, the numbers of youth who have either reported that they have bullied or been bullied in the past year. And every year we are tweaking those surveys to get more information. They're listening to the partners as they say, I think we need to ask kids about this so we can get better information. So we're getting more information, and that enables us to tailor our prevention practices a little more.
And Gail, in terms of the mental health issues with youth, particularly in light of the current incidents, what kind of messages should we be sending, and are the ones that we're sending now being effective?
Well, there are a variety of messages that we can send out. I'd like to use our grant program that is taking the good behavior game, which is an evidence-based practice, to 21 elementary schools across the country. What the literature tells us is that two major risk factors, early aggressive and disruptive behavior by elementary school boys in particular, lead them to be at risk for a variety of outcomes, both mental health problems as well as substance abuse problems. So by going early into a young child's life, we can begin to put them on the developmental track that works. And this seems to be working across the country.
And Richard, this all assumes that the best way is through messaging, yes, but once the youth is affected in some way, they really do have to be assessed. What does that mean, to be assessed?
Well, it's really important that we look at youth who are having problems in any sphere of life, because this is often such a web of risks that are interrelated. But it's also important that we recognize that everybody in this age group is at risk, so we really ought to be screening children on a regular basis. And this can happen, all children, absolutely. So this can happen in medical settings, but it can also happen in schools. It can also happen through other youth-serving organizations.
And what is the definition of screening? What should a parent be knowledgeable about in terms of screening? What does that entail?
Yeah, it's real important that parents be knowledgeable, because often parents hesitate a bit, because this does involve asking kids some pretty personal questions. And parents hesitate, is this going to be in the record? Might this haunt my child in the future? But in reality, it's real important that we be asking kids questions about tobacco use, substance use, various symptoms of mental health disorders, so that we can identify issues early and head big problems off.
And this is from the parents' perspective. Pierluigi, what happens? What should the parents and friends of those youth also be cognizant and on the lookout for?
Well, I think parents need to be in the lookout for any change of behavior, any change of friends, any change of attitudes. Friends need to be cognizant about those changes for several reasons. We are learning more and more. We used to think that the parent was the most important voice in that children's life. Today we're finding out that it's older siblings and friends that are the most important voices. So as parents, we also have to keep an eye on who are my children's friends, and as for those who are positive friendships, to make sure that we continue to support those positive friendships. But we do need to look at changing behavior, change of clothing, change of attitudes, and also some isolation and some of the other negative type of behaviors that we're pretty much learning that it leads to some unhealthy symptoms.
And Gail, you mentioned the whole notion of the youth that are affected by some mental health problems that also go to addiction. For youth 12 to 17 who experience depression in the past year, and this is 2011 data, they were 2 times as likely to take the first drink or use drugs than other youth in that cohort. Talk to me a little bit about that.
This reminds me, we can approach it 2 ways. One way is to look at the issue of early intervention, or intervening early in the course of the illness. So you want to try to find people that are beginning to experience depression at the point of being a diagnosable problem.
And what would a youth act like if they were beginning to experience depression?
Well, oftentimes they withdraw. Their behavior is not like it was before. They're less social. They might report that they can't sleep, or they sleep too much. They have less of an appetite or more of an appetite. These are important things to look for.
And sometimes it's the opposite. Sometimes kids will actually be depressed, but actually more agitated and acting out more.
That's right. I'd like to also add a point about prevention here. Dr. Greg Clark from Kaiser Permanente a number of years ago did a wonderful study. He knew that mothers within the health organization who got depressed put their kids at risk. So he then developed and studied, and we have the good randomized control trial that lead us in this, that he developed an evidence-based practice for youth whose parents were depressed, who are not yet depressed yet. And so it's a preventive intervention, it's a cognitive behavioral format, and I think it's very encouraging.
And Kristen, how does the school system then, you can certainly do your surveys, but what do you do when you do begin to see a pattern of behavior within a student, and how do you capture that, and how do you approach that student?
Well, it's of the utmost important that the school personnel are working together. We have school social workers, counselors, and psychologists, and in some cases we also have a substance abuse support person from our CSB, the Community Services Board. And they are working together and communicating on the youth who've come to their attention, and then strategizing on how they can best support that youth. Now, of course, the school systems they're limited in what they can offer in treatment. So where programs like ours as a nonprofit agency come in is to make families and the community aware of what resources are there for them so that they can seek effective treatment for youth. And going back to something Gail was saying earlier, you were talking about how early aggressive behavior is a key thing to be aware of for young children. And we're really, at our organization, trying to bring attention to the fact that we want to start paying attention at that point and bringing effective treatment and therapies to youth at that point rather than waiting until later when there's a crisis that occurs.
You know, the other issue that you mentioned, that you try to get them treatment. Well, we know for a fact that only about, I would say, 10.8% of the people who really need treatment, of the 20.6 million that are affected, and this is the entire population 12 and older, that have a problem. So how do you begin to weed out and with those families to try and get them help?
Mm-hmm. There's actually a program, a national campaign called the 1 in 5 campaign, which states that 1 in 5 youth have an issue, and of those 5, 1 of them gets treatment. That's sort of the rule of thumb that we go by. And so there are a lot of different things that we try to do in our community because we're aware that nationwide it's a problem with resources. Providing access to effective treatment is a huge problem across the country.
So when we come back, I want to continue with that train of thought because I think that will be very helpful for our audience. We'll be right back.
We want everybody in the community to understand signs and symptoms of mental illness and of addiction, so that, or even just an emerging problem, so that individuals can know when either themselves, their family members, or a neighbor or friend is having difficulties and they may need to reach out for help. So increasingly, we're trying to help people understand what addiction is about, what mental illness is about, what mental health conditions are about, and what substance abuse is about, so that we can identify these signs and symptoms sooner, and so that neighbors can help neighbors in reaching out and getting the help that they need.
What SAMHSA is doing with regard to facilitating the integration of the assessment of mental and behavioral health problems in the primary care settings, our major initiative is the Screening, Brief Intervention, Referral to Treatment Initiative, which lodges the screening in the primary care setting. So as part of the primary care team, what the mental health counselor or the substance abuse counselor would be doing is asking questions about alcohol and drugs, and also dealing with mental health issues.
Recovery benefits everyone. Substance use and mental disorders can be treated. It all starts on day one. Join the Voices for Recovery. For information and treatment referral for you or someone you love, call 1-800-662-HELP. Brought to you by the U.S. Department of Health and Human Services.
So, Kristen, do you want to continue telling us exactly how you help those parents try and seek help?
Yeah, one of the things that we've been doing over about the last year is a community education program. I had the opportunity to go and speak to all of the about 500 counselors in our public school system. We have one of the largest public school systems in the country, and give them information on helping youth not only to access the services that are available, but some information about self-care. So we do a lot of community education around the importance of sleep and nutrition and exercise and things like that, so that youth who don't have access or who aren't ready to access treatment have some strategies that they can pursue on their own. But I've also done that program for parent groups, for PTAs, and we're actually going to be having a TV show coming up in the next couple of months on our local government channel, where we'll be talking about a lot of those kinds of topics also. We do advocacy around the community. We work with our local government and the school system because, like I said, we're not a non-for-profit, so we are not linked directly to the government or the school system. We're kind of working in between with the community-based organizations.
And Gail, does that parallel some of techniques and approaches that you do in some of your programs?
Yes, it reminded me of the concept we use in a couple of our programs, which is, and for prevention in particular, we know that mental health professionals, for example, most of prevention will not be done by the mental health community, but it will be done by people in the social settings where children are. So in the program in which we're moving the good behavior game to elementary schools is the prime example of how teachers are preventionists. And I think that's also another way to look at the problem of early intervention, trying to find kids who are just becoming ill with mental health or substance abuse problems. We know that if we can train those that are in the social sphere where children are to know more about these issues, then that's a way to get them to treatment.
You know, and I really wanted to mention when we had our prevention program, we started it in the middle school and we moved it down to the elementary school. But the important component for us, because we started mental health promotion at the same time that we did substance abuse prevention, and our key component was the parents. We needed to have a very strong parental component because we work with immigrant parents. We work with Latino parents, and there was a great disconnect from what the children were learning and doing to what the parents thought they needed to be learning and doing. And what we found out is the children were our partners in helping educate the parents about mental health promotion and substance abuse prevention.
But you also worked with the parents.
Correct.
Yeah, you trained the parents because you had a very, very unique situation there for a while where you had a lot of suicides in your community.
Correct. And besides being the silent epidemic, in Latino families, it became a very difficult topic. So we did engage the parents. And today, actually, our suicide prevention program has grown where we're now also training Latino youth to be suicide peer mentors at the schools. And that program is also beginning to develop and give us some excellent results.